In this training video, we're going to look at powerful new solutions for joint pain and joint health to improve quality of life in patients. Now, what's really interesting, different people experience different types of joint pain, and in Canada, over 4.5 million Canadians suffer from joint stiffness, joint swelling, or joint pain. And you know these ones, they can tell when it's going to rain. And over 20% of Canadians that are over 46-year-old reported pain in their joints every day. And very interesting, this limits or prevents over 13% of Canadians from participating in daily activity, and that's taking away from quality of life. And what's interesting as well is the explosion in the demand. There's over 26,000 North Americans that will be turning 50 every day for the next 20 years. There's going to be an explosion of people that have this demand and want joint relief and pain relief. And for Canadian seniors, they're going to increase from 15 to 25% over the next 15 years. Again, in clinical practice, you're going to need help with osteoporosis, joint pain, chronic pain, dementia, hormonal change of life, and hot flushes. This is what's coming down the pipes, so be prepared. And what's interesting with our Americans to the south, a national survey revealed that nearly 1/3 of U.S. adults report suffering from joint pain of some kind within the last 30 days. And knee pain was by far the most common single site for pain or stiffness. The road to chronic joint discomfort is not exactly what we thought it was. I remember back in university, I was taught that I would get osteoarthritis because I was a triathlete, I was a runner, and I was going to get the wear and tear arthritis, whereas others who had autoimmune problems, they would get the rheumatoid type arthritis. Were you taught this as well? I think we all were. But what's really interesting, for the first time, Stanford University has demonstrated this is not true. It turns out that osteoarthritis is accompanied by the same pathological, pro-inflammatory immune factors that are involved in rheumatoid arthritis. So what they're saying is it's low-grade inflammation that contributes to osteoarthritis. And even more compelling with their findings was that if the treatment was initiated before symptoms are manifested, so if the low-grade inflammation was dealt with, osteoarthritis may be entirely prevented. So when there's a group of 25 researchers making statements like this is very powerful. So how is this unfolding? Well, when we look at cartilage tissue, say in the knee joint, and that's in our diagram here, there's always a rebuilding and a breakdown. And this is a non-selective process. It's always turning, and Mother Nature designed our tissues this way. This is excellent. But what happens is, if there is an excessive recruitment of inflammatory T cells, say from the immune system, and this could come from the immune system in the GI tract, the gall, the malt, the Peyer's patches. This increases the migration of these immune cells into the cartilage, and they start breaking it down. And at the same time, you're getting more of these inflammatory cytokines, TNF-alpha, IL-6, IL-1, and so on. And further down the line, we get activation of proteases. These are these little Pac-Man looking things, these matrix metalloproteins that get in there and start breaking down the cartilage as well. And ultimately, farther down, proteoglycan production falls off, chondrocyte death occurs, cartilage loss is experienced, and you get bone on bone and that true osteoarthritic condition. And again, this isn't just a matter of taking something like glucosamine, that's the building blocks. It's the reduction of the inflammation and the migration of these inflammatory immune cells from the immune system. The researchers also stated that what was really interesting, the low-grade inflammation is not merely an early symptom of osteoarthritic cartilage destruction in synovial joints. It is the trigger that causes it. Now, what these scientists have also discovered is that there's a substance called undenatured type 2 collagen protein. And through a process called oral tolerance, the body can be retrained to not attack the collagen that's in the joint tissue. And oral tolerance, you might be familiar with something this in terms of seasonal allergies, where people are given allergy shots. And going way back, probably 40, 50 years ago, this was used as a method to reduce certain types of allergies. And now, in certain things like homotoxicology, they are using sublingual amounts of antigens to downregulate and cool off the immune system. So oral tolerance can retrain the killer cells so they recognize collagen as a harmless substance, and this prevents them from attacking the cartilage in the joint space. So how does this play out? Lugo and others in 2013 did a double-blind placebo-controlled trial with 55 people looking at this. They gave them the undenatured collagen protein versus a placebo. And remember, this is 40 milligrams. This is a small amount. This material is not even being absorbed into the system. It's acting in the gut on the Peyer's patches. And what did they find in this trial? Well, they had a positively influenced knee extension, a marker for function in the body. They are able to exercise longer before experiencing joint discomfort, and they recovered from joint discomfort faster. And so another group did a similar type trial, but this time they compared the undenatured collagen protein, the same amount, 40 milligrams, against the gold standard, which was glucosamine and chondroitin. And what happened in this trial? They had similar results. There was improved physical function, reduced stiffness and pain. It provided joint relief more effectively than the glucosamine and chondroitin. And interesting enough, it improved the ability for daily activity. It improved the quality of life. So if we looked at this in a different style of graph, you can see that the undenatured collagen protein had more than twice the improvements versus the gold standard of glucosamine and chondroitin. This is something your patients want. Remember, glucosamine doesn't work in everybody. It doesn't work an overnight, and some people it even causes GI distress. This undenatured collagen protein seems to be working faster in a wider variety of people and getting even better results. But there's more to this story. Remember, we've been looking at inflammation and migrated immune cells, and that's what the collagen proteins doing. It's reducing the migration of some of these immune cells that attack the cartilage in the joint space. There's another ingredient called enriched hops, or enriched THIAA. And this is a new concentration of hops with an even higher anti-inflammatory potency and better GI tolerance. And this works in almost a dose-dependent manner to reduce prostaglandin PGE2 in the body. So OsteoVantiv is a new breakthrough in joint health that has these two ingredients. It has the undenatured type 2 collagen that's standardized to 25%. This is important. There are other standardizations and amounts that are on the marketplace. So you want to make sure you get the higher 25% undenatured type 2 collagen, which Metagenics provides in OsteoVantiv, and you get the enriched form of the hops. So how is this working? Let's go back to our diagram. The undenatured collagen protein is downregulating the immune system through the gut immune system in the Peyer's patches to reduce the migration of the inflammatory cells into the joint space, breaking down the cartilage. And interesting enough, the hops concentrate is reducing the matrix metalloproteins, those little Pac-Man, as well as the inflammation that is contributing to joint destruction. This is really important. And then a small case study was done, and what was discovered after 12 weeks was there was a 58% average decrease in reported joint muscle complaints. So effectively, this is supporting joint health and quality of life. This is a great new product to introduce to your patients. So OsteoVantiv is safe and effective for long-term use. The case studies went out 8 months where they're looking at liver function, kidney function, GI health, and so on, and bleeding. And the results were very positive with no observable side effects. It's safe and tolerable, and we get some great results. So OsteoVantiv is a breakthrough in joint health, in relief, flexibility, and function, and it's designed to provide powerful joint relief without GI side effects. And the good news, clinically effective dosing in just 2 tablets per day.